Next speaker, Enrique Teran, professor of medicine, about the case in Ecuador. Professor Teran. If he's not connected, then we can go to...
Thank you.
There he is.
Yes.
Hello.
First of all, I would like to thank you, the organizers, for giving us the opportunity to share our experience from Latin America, particularly to Monica for organizing this very interesting discussion. I will share with you something that we have been working as part of the Latin American network against the tobacco harm reduction problem. These are my disclaimers, and everyone knows and has been concerned due to the problem of COVID-19 pandemic that we have been ending recently, and it caused nearly 6 million deaths worldwide. However, all of the time we are forgetting that each year around 7 million deaths are directly related to the tobacco consumption. So if numbers are quite similar, the importance should also be similar. That is what happened in Latin America. This is a picture of several countries in the region. Interesting things, what is happening with Chile, that is the country with the highest rate of tobacco consumption, while Colombia is very low. But obviously, in the last decade, numbers have been decreasing in all of the countries. The mine is not in the list for lack of data, basically. But this is what our Ministry of Health is showing and is obviously concerning. When you are looking at the smoke rate self-reported by consumer, you see that doesn't matter which one is the decade of age, this is affecting almost 30% of population in average. This came from PAHO, Pan American Health Organization, and report data that seems to be lower than reality. If you contrast the upper picture with some data published recently in the Lancet Global Health, you will realize that the source of information make an important point of discussion. While most of the countries in our region are capturing the number of smokers based on tax rebate in the amount of money that the government is getting due to the market, legal market of cigarette, when you ask people, percentages are quite higher. And this is important to really understand what the problem is in each region. There is no doubt that tobacco consumption has been decreasing. However, it seems like in most of the countries all around the world, there is not enough results with the regulatory actions like the prohibition and the tax imposed to cigarettes, because it creates a problem with illegal commercialization and illegal consumption of tobacco. This is a huge problem, particularly in those less regulated countries like mine, because the illegal market seems to fit into the apparent legal commercialization and is creating an additional problem. We studied with some of my colleagues this problem in Ecuador, and we revealed that the number of smokers are increasing, but are not captured by the national data. And of course, the bigger is the illegal market, the bigger is the problem for our own countries. Another important point, and how not to mention, is the refusal leading by the WHO to discuss openly about the harm reduction problem. Now we are in days of the COP this year, and we were hoping this will be included in the discussion, but seems that will not be taken in consideration either. To mention what Professor Russell always mentioned, the problem is that people is confusing smoking with nicotine, and nicotine is the reason behind people is smoking, but nicotine is not the harmful problem of smoking. So we insist, particularly in Latin America, that the concept of harm reduction is additional and complementary to another tobacco control strategy as cessation and prevention. However, look what is reported for Latin America in terms of tobacco use versus heated tobacco products consumption. And in all single countries, regular tobacco is much more frequently used than other less risky products. And as you hear in Brazil, as you hear in Mexico, and in most other countries in the region, the problem is that the authorities are closing the door to alternative devices, alternative options, so population is still consuming the classical ones, the high risky ones. We decide in Ecuador, and we are currently doing this in other Latin American regions, to do a KIP survey about tobacco harm reduction to the healthcare providers. So that was an electronic survey with around 40 different questions about tobacco consumption, health risk, nicotine, and of course, e-cigarette. That is the distribution of our population. We reach approximately 350 health providers, mainly physician, either specialists, resident or recently graduate, nurses, psychologists, students, and other healthcare providers. And the most interesting results in function of time is about nicotine. 90% of our surveys related nicotine with the diseases due to tobacco. Unfortunately, the confusion is in the air. We need to work on this. And even worse, 93% of responders think that nicotine is responsible for lung cancer. So then it's easier to understand why they refuse to understand, to accept alternatives, because they believe that the nicotine is the true problem of tobacco consumption. Regarding to electronic cigarette, 75% think that is equal than tobacco for health. They do not differentiate harm reduction. 81% believe that create the same addiction than tobacco. 59% that is not secure at all for health. And 17% really think is an alternative to reach sensation in our population, while only 21% accept in favor to its use as complementary tool to sensation. In summary, there is still a long way to reduce globally tobacco consumption. Every one of us need to help those already smoking to try to reach cessation. Your help of each one of you is necessary to educate healthcare providers, people, authorities about nicotine, and to separate the problem of tobacco consumption and the nicotine addiction and use. The policies based on evidence must be implemented to reach tobacco harm reduction. We need to be objective, and as was mentioned previously, authorities cannot take decisions based on lack of scientific information. And finally, the big and remaining question is, can the regular cigarette become obsolete? It pretty much depends on giving alternatives to people that is currently smoking. Otherwise, will be very complicated, and we are inducing them to keep smoking as they are. So that was the summary that we wanted to share with you. Please visit us in reldat.org that can get more information about our activities. Thank you very much.
Very much, Professor Teran, for your experience in Ecuador. And for the sake of time, let's go